Mothers and children on the floor, elderly on trolleys, 95 patients for 33 beds and corridor nurses. Shocking pictures reveal the true state of our hospitals. These are the worrying scenes in the A&E unit of one of the country's top-performing hospitals. At one point last week there were 95 seriously ill patients waiting to be seen, but only 33 beds. Mothers sat on the floor with babies on their laps while the elderly queued up on trolleys and in wheelchairs. Managers at the Royal Blackburn Hospital in Lancashire have even resorted to appointing designated corridor nurses to take care of all the patients waiting without a bed. Doctors say they are taking too many risks by sending patients home early, and nurses report conditions as dangerous and frightening. The images were filmed by the BBC last Sunday and Monday after it was granted rare access by the hospital's chief executive Kevin McGee as part of the corporation's week of special coverage on the NHS. It is unusual for a media organisation to be given fly-on-the-wall facilities. One doctor was filmed indirectly asking the government to take action over the NHS, while another appeared to be on the verge of quitting. A&E units across England are in the grip of one of the busiest winters on record, and doctors say conditions have never been so bad. The problems have been blamed on a lack of social care funding, with elderly patients becoming trapped in hospital unable to go home, creating a shortage of beds. Health Secretary Jeremy Hunt has urged patients to avoid exacerbating the problem by avoiding A&E if they aren't seriously ill. Theresa May has criticised GPs for not opening their surgeries for long enough, forcing patients to go to emergency departments both during the week and out of hours. Blackburn's A&E unit is one of the busiest in the northwest. On a typical day last week about 545 patients arrived through its doors. It is one of only 40% in the country to have been rated as good by the Care Quality Commission watchdog. Most are described as either requiring improvement or inadequate, suggesting the situation in other casualty departments may be worse. The Royal Blackburn, run by East Lancashire NHS Trust, has been particularly hard hit since the Chorley Hospital's A&E 13 miles away was downgraded to an urgent care centre last April due to a shortage of doctors. It was upgraded in the middle of last month back into an A&E unit, but it is open only 12 hours a day, from 8 a.m. to 8 p.m. Dr. Khalid Haque, one of Blackburn's consultants in emergency medicine, said he had never known a department to be so busy in his 26-year career. He added, "The problem is we are taking too many risks now. We are sending home patients we shouldn't be sending. We've got nowhere to put them. It's dangerous. We need more staff and we need more space. There will be patients here from 6 to 8 hours and we can't find a bed for them."